Hello, my name is Megan Strickler, and this is case study number 1 on vitamin deficiencies. Our patient presents as a 24-year-old female. She is 5 feet 6 inches tall, weighs 115 pounds, with a BMI of less than 18.5, making her underweight. She was recently diagnosed with depression at 23 years old, but she is not currently on any medication by choice. She has maintained a strictly vegetarian diet since the age of 18, but she is not opposed to eating eggs and or fish on occasion. Let's see, she had been diagnosed and treated for anorexia in high school between the ages of 15 and 17 years old, but she claims to not have problems with that anymore. She does have a history of alcohol abuse and binge drinking during her early 20s. Again, she says that is a resolved issue, but it did last for about 3 years. She is recently married and hoping to have a baby soon, so she has begun taking folate supplements just last month, and this desire to have a baby soon is her motivation for coming to see you today. She has also been taking iron supplements and B12 energy shots to relieve the constant tiredness that she has experienced for the past 6 months. Her current alcohol consumption is still at about 3 to 5 drinks per day. Her symptoms, she constantly feels fatigued. She has a recent loss of appetite and also a recent weight loss. She's lost almost 10 pounds in the last 3 months, and she was already close to being underweight. She's also been complaining of having poor concentration, irritability, some bleeding gums, and a recent difficulty she's noticed just being able to perform normal day-to-day tasks, such as unloading the groceries or carrying them in from the car, and walking around and lifting, doing household chores. When asked about what she's eaten in the past 24 hours, she says that this is a pretty typical diet of a regular day. For breakfast, she had a cookie with 2 cups of coffee. Mid-morning, she had another cookie. For lunch, she went out to lunch, had chips and salsa and a cheese quesadilla at a restaurant. Afternoon snack of Cheez-Its and Diet Coke. And for dinner, she had at home a tortellini with tomato, basil, and olive oil. Her alcohol consumption, she had a margarita at the restaurant with her lunch, and at dinner she had 3 glasses of white wine. As previously stated, she is taking iron and folate supplements, but not a prenatal vitamin. And this morning before she came in, all she has had today is coffee. My questions for you are, what nutrients and food groups are most obviously missing from her typical diet? Although she has begun taking the folate supplement, is it possible that some of her symptoms are caused by a deficiency? The most alarming symptoms are the patient's constant fatigue, recent loss of appetite, recent weight loss, and poor concentration. What nutrients is she lacking in her diet or improperly absorbing, and what could be the long-term contributors to her body's improper absorption of these nutrients? And finally, knowing the patient's sensitive history of anorexia, depression, and alcohol abuse, what are the most appropriate ways to approach her lifestyle and diet choices in order to make nutrition recommendations? And what foods would you recommend? Thank you.